All right, good morning, everyone. Thank you for joining us for another Reports and Updates Coloradan efforts to disentangle mental health and criminal justice. This morning, we are joined by Kelley Terrell with Mile High Behavioral Health. She's going to be discussing their competency program. So thank you so much for joining us this morning, Kelley and everyone else. Take it away. Thank you.
Hi, good morning. My name is Kelley Terrell. As Adam said, I am with Mile High Behavioral Healthcare. We are, for those of you who don't know, we are an outpatient substance use and mental health provider here in the greater Denver metro area. And so let me get this presentation going. There we go. Is this, everyone can see this? Thumbs up, anyone? Okay, perfect. All right. So this here is our pre-release case management competency restoration program. A little bit about me, like I said, I'm with Mile High Behavioral Healthcare. I'm a licensed professional counselor and addictions counselor and an approved clinical supervisor. So at this point, I mostly just supervise teams or other provisionally licensed or licensed clinicians that are working with all kinds of different subpopulations here in Denver and our outlying counties. So the presentation today, I'm going to talk a little bit about kind of where the program started and why we created it, and then how we currently operate and a few things that we've learned so far. This is still a really new program for us. We're just coming up upon a year of having our staff and getting referrals. So we're still very much in the learning phase of what works, what doesn't work, and what things are most important for this population. So that's what I'll share at the end. All right. So a little bit of background for those of you who don't know much about Mile High. We, like I mentioned, do substance abuse primarily, and then mental health as well. And we are really known for working with a lot of really specific subpopulations. We have a large GLBTQI program. We have trans-specific programming, gender-specific. And then we do a lot of work with our criminal justice system. We do, I think we're in 9 different problem-solving courts around the greater metro area. We do jail-based treatment. And then we've had a number of different reentry programs over the years. So in 2021, we were approached by the forensic support team and asked, hey, we know about the work you're doing. We have a number of clients who are currently incarcerated in Denver who really need substance abuse treatment. Can we make a referral to you? And I said, of course. And then through that initial referral process, we had like 1 test client. It became really apparent that there was this big gap between trying to refer a client to treatment and get an intake scheduled and actually meeting the client in custody. So someone asked like, hey, can your person just go and meet them in jail, get them an intake appointment and get them straight into treatment? The challenge with reentry work is because we cannot utilize Medicaid funding to reimburse for the time spent. All of our reentry programs are really funded under either grants or vouchers or some other separate funding stream. We don't have a lot of people who can just go in and meet with inmates. So it's a definite barrier to community agencies being able to work within the jail. So to address that, we worked with the forensic support director and with the support of the fines committee and with Signal, we were able to secure some funding to create a program of 4 case managers whose job it is to go into the jail to work with these competency restoration clients who, seem appropriate for the community and then get them set up, get as many of the things ready for them to come to Mile High for their treatment, housing, all of those things. And I'll talk a little bit in a minute about what the process looks like. But that was really where the gap was having a treatment provider who could go into the jail, build relationships, and then pull the clients to us in treatment, not only just for outpatient restoration, but for substance abuse and mental health support as well. So in March of 2022, we were able to secure the funding for the position. And then it took until July to get people onboarded, trained, and to be ready to go. So that was when we were able to take our first client. So a little bit about how the program works. So all of our referrals for this specific team comes directly from the forensic support team. So the navigators look at their caseload. Obviously, they're identifying clients that they think are most appropriate for community restoration. And for our program, they're also trying to target clients who meet criteria for a moderate to severe substance use disorder. Our population at Mile High tends to be pretty on the severe side for substance use. So we wanted to kind of be careful about making sure that the clients we brought in from this program would fit within the kind of clients we're currently serving. And we tend to do well with that population, so it made sense. So the clients appropriate for the community and then meeting that hopefully moderate to severe substance use disorder criteria. Once the navigator is able to identify that client, then we're going to get the referral with the collateral and everything we need to then go into the jail and have that initial screening on our end. Currently in the Denver metro area, so basically from Douglas County up to Boulder, our staff will go in person for the most part for all of those meetings, provided that we're able to. We've gotten clients from much farther away, Larimer, I think we've got Los Animas, pretty far reaching. Those appointments, usually the navigator or somebody helps us meet with those individuals virtually. We are working with clients in those farther reaching jails only if they're needing to return to the Denver metro. Because again, the point is for them to continue in services with Mile High once they're released. But there are plenty of clients who unfortunately get incarcerated in other parts of the state and are hoping to return home to the Denver metro area.
I don't think it's
so. Our case manager is going to come.
There's something also happening on your skin in that same area. It makes me think it's not.
I think Sonia, if you're not muted, if you don't mind muting. Thank you. So yeah, our team is going to go in and do that initial screening. We are really looking on our end again. Do they have a substance use disorder that needs treatment? We have very few exclusions at Mile High. Really, the only one that we can't really budge on is if the individual has to register as a sex offender. We do have a child and adolescent license for treatment, and so it makes it so that we can't treat both populations. So we're just double checking that that's not there, making sure that they meet criteria for that substance use disorder. And then do they want to do a program like this? Do they want to do sober living? Do they want the support and things like that? So just double checking that they're appropriate for us in general. We try to do that initial screening within 3 days of getting the referral, 3 business days. Again, a lot of these releases with outpatient restoration are really quick. So we want to make sure that our case managers get in and visit as quickly as they can. After that initial meeting, we're going to update the navigator, and then we're going to continue to meet with the client in custody as much as we need to. The process can take months for some clients. And like I said, sometimes we will get like a 911, hey, this person's getting out in 4 days. Can you squeeze them in? And we will try our best to meet that need. In those ongoing meetings, if we think that they're appropriate for sober living, we're going to help complete any referrals or the application. Currently, we partner with Ananeo Sober Living. And then just this last month, we also are working now with Monarch Sober Living. So another thing our case managers are screening for is which program is most appropriate. They both operate a little bit differently. So based on what we know about this client, where do we think they're going to be most appropriate? We're going to make sure that if we're working closely with that navigator, is the referral to Rocky Mountain Human Services for any momentum funding taking place? Has a care package been ordered? Any of those kinds of things. We want to make sure we're going to try to check those boxes during these ongoing meetings. And another big piece of this is we're relationship building. That was really the impetus behind a lot of this, is we want to get to know this person so that they are more likely when they get out to follow through on the plan we've created, and they feel safe coming to our office, meeting with the person they've been meeting with in custody. Anyone who's working with these clients or clients in the criminal justice system know how many people they interact with, and having one person from start to finish is really, really helpful in terms of actually following through and getting to a treatment provider or any sort of community service organization. As we're getting close to the day of release, we are really going to look at like what's happening the day. How are we getting from jail to their next sober living? How are the meds going to be transferred? So our jails are usually great about making sure a script is sent to, any of our local pharmacies, but we want to make sure that that actually happens. And then, who's going to be picking it up? Things that seem really minimal, but are really, really important when you're getting out. Inmates and clients are very overwhelmed when they are released. And so it's important to, try to problem solve as many of these things before. Otherwise, it can be incredibly overwhelming to try to problem solve on the fly. I see the question about the Monarch program. Yes, I can definitely, when I'm done, I'll follow up and send links to Ananeo and Monarch Sober Living. They're very new to us. So I think there's one client who has come to Monarch that will be working with us. But from what I know and understand, their program has a lot of hands-on day-to-day case management, and they help a lot with transportation. They really want to keep the clients busy and engaged in some programming. So if they're not going to be with us for treatment, they're going to try to keep them as busy as possible at their housing, just to help support them to stay focused on their plans and stay sober. So they seem very, very hands-on, but I'll be sure to send out links to all of the different agencies that we partner with. Oops. Okay. So now the client is going to be released. We are going to try to meet with that client within 24 to 48 hours of their release. Depending on what we have happening, we really try to meet them quickly, just to, again, reassure them that we're still working with them. And then again, if there are issues, we want to problem solve them as quickly as we can with pharmacy issues. Sometimes the script doesn't get in, the care package doesn't arrive on time, they might have court right away, like whatever it is that's happening, we're going to work. And if it's not going to be us that addresses the issue, we're communicating with Sober Living to make sure one of the team members is working with the individual to get the problem resolved. Next step is we're going to do the intake with Mile High. So whether that's for outpatient restoration with us, and then for substance abuse and mental health services. Substance abuse, we want to make sure people get in as quickly as we can. Our sober living providers really, really want people to follow through with their substance use treatment. For this population, that can look a little different. They're not always the most appropriate for group therapy. So we're looking at more individual work. We're looking at peer support, which we do a lot of. And I'll talk a little bit about a newer program we have that is designed to support this population. We also at Mile High offer medical and what we describe as light psychiatric care. We have a PA on staff with us named Jacob, who is fantastic. He literally works down the hall from us. So it's very, very easy to collaborate with him and explain what we are seeing. The client's going to report what they're reporting, but the treatment team can actually explain, like, this is what we're seeing. This is what Sober Living is seeing. So the client may be saying everything is fine, but this is what other community members and what the treatment team is seeing in their behavior. this is newer for us. Medical is newer. We've always partnered with Front Range Medical. They do Suboxone, methadone, or excuse me, they don't do methadone, sorry. Suboxone, Vivitrol, things like that. But having our own PA on staff is a little new for us. So we are figuring out the issue of medications that require labs. We've had some hiccups with different labs we've tried to use. So we're trying to do more, like not some of the heavier antipsychotic medication yet, things that are going to require ongoing lab work. We want to make sure that that process is working before we say, yes, we're ready for that level of medication. But we will refer to Mile High Psychiatry, and we have another community provider we will refer to who can do those medications if that's what it seems like the client needs, or if we get collateral that tells us, yep, this is what they're taking, we really think they should stay on it. But we can also do, like I said, medical. So if people just don't feel well, they can see Jacob for, you know, any flu testing, any general stuff. So again, it's the population that doesn't want to interact with a million different providers. They're hesitant to get medical care. They're hesitant to seek out services. So as much as we can do in one stop, we are going to try to do. And then from there, they're going to stay in wraparound care. They're a client of Mile High, so they'll hopefully continue to do their outpatient restoration with us. But when restoration's over, we are not done with them. You know, whether that's they continue with this team. I think we've put it that we'll continue at least for 90 days post release, or post, you know, when however their restoration resolves. But at that point, they're a Mile High client. They can engage in our services as anybody else does for however long is appropriate for the client. This is a little table, and I will also include some handouts and information just about like Mile High and what we do and what we offer in that follow-up email. But again, pre-release, all those things I talked about, case management, medication coordination, and then that relationship building. The relationship is super important. Post-release, a lot of the same things that I've already talked about. Peer support. We have both peers who are, they have lived experience both with substance use and some really significant mental health. So we have great people to really walk alongside the client and encourage them and really instill hope that things can improve, things can get better. And then our ongoing care, all of the things that Mile High provides, which I will send more information on. And that's this kind of snapshot is the different things that Mile High does. One thing I wanted to highlight is our Genesis program. This is another new program for us. It's a specific program for the mental health, the SPMI population. So we were able to get, again, some grant funding to build a clinical team whose job it is to support this SPMI group. Again, these are clients that are not really appropriate for a lot of our bigger substance use groups. They're a different kind of client who needs a lot more individual care. Treatment plans need to look a lot different. And we need more creative and like flexible approaches to working with them. So we were able to bring on some therapists and our mental health peer to serve this population specifically. So we're really excited about that. That is very early. We just got the funding and I think we're 50% staffed with that one. But I'm very excited for that because it is very, very much needed in all of our courts, but especially to support competency restoration. Our substance use services, Mile High is a large umbrella of lots of different things, everything from shelter to, we have the Aspen Center for Women, which is our residential treatment program for pregnant and postpartum women and their babies. Our Transcend Aftercare program. So even when you successfully complete treatment, we are not done with you. We have community events and we have an aftercare program so that people can stay connected without needing to be in the same level of treatment that they were in. And in fact, today is our graduation. So we're very excited. I think we have about 80 graduates over the last year who get to walk and kind of celebrate their success. And then, yeah, other supports. We have a food bank. We do lots of community events. And then we do try to give clients like bus tickets and things like that to make sure they can get to and from treatment. All right. And I know I'm going really fast. So at the end, I'll be sure to check for questions. But some things that we've learned. Number one is that the pre-release work is really essential. We see a much higher rate of success for clients who we actually got to spend some time with in custody when they come out into the community. They already know us. They're happy to see us. We're a familiar face. We can just provide some stability that someone is going to walk alongside them to figure this out and that they're not on their own to try to problem solve issues as they get adjusted to the community again. It also helps us identify the barriers they're going to hit, the things that we think are going to be a problem when they're released, or just making sure everything that we can get set up in advance is done before they hit the ground running. This is no surprise, I'm sure, but these are clients that need a lot of ongoing intensive case management, down to, texting reminders about court dates, checking in with sober living constantly about, hey, how's he doing today? He had a hard day yesterday. Our case managers are really, really involved with the day-to-day lives of the clients because we have to in order to keep them, stable and support them. And it just makes sure that we know big picture what's happening with them. And then the last big takeaway is that these systems are really complicated. Even as a professional, it's sometimes really hard to navigate all the different roles that people have, different teams that have different systems. We've got pretrial stuff, we've got courts, we've got jails, and then we've got all of the community supports. So if we are having a challenging time trying to navigate all of it, that's incredibly overwhelming for the client. So as much as we can do on our end to build relationships, to try to streamline processes, that's what we're trying to do because we want to make sure the client isn't the one trying to figure this out themselves, because that's where they're going to give up and not try because it is just very complicated and confusing. And we're working with the population that we've already said is going to struggle to understand how the systems work. So doing as much as we can to ease that for them is really important. And these are our partners. Like I mentioned, we have the funding for this program is from our fines committee, and the Signal also helps support us. We coordinate a lot with, obviously, DHS and Rocky Mountain Human Services for all those care packages for our clients. And then Ananeo and Monarch are our sober living providers. But our clients are housed all over. So we travel a fair amount and we just kind of go wherever the client needs to be. This is my contact information. And like I said, I'll send something to Adam so that he can disperse it to everyone with all of our general information. But if anybody has any questions, I'm happy to answer those. I know we only have a couple minutes, but if anything pressing, happy to answer. All right. It must have been an amazing presentation since no one has anything.
Definitely an amazing presentation. Thank you so much, Kelley.
Thank you for having me.
That's great work. Thanks for joining us. So this presentation has been recorded and will remain available on our website in case anybody wants to share it with anyone else who may be interested.
Thank you.
No questions. Thank you so much. Take care. Thanks all.